Hi everyone, welcome back. So today I'm going to be talking about something that I sort of touched on in a lot of my posts previously. Basically, you're going to be talking about sort of when massage and medicine kind of collide and come together. Now I'm always saying, those of you that have read or seen a lot of my posts will know, I'm always saying, if you have a medical issue in particular, do see, ensure that you see a massage therapist who is not only registered, but who is qualified and experienced in the issue that you have. Because there are too many therapists out there who, are barely even qualified, let alone registered, or have any real knowledge of the anatomy and physiology behind your issue, which means that they then can't actually really explain to you what the problem is or what you can do about it. And I'm going to explain obviously why why this is so important in terms of medical issues, and give you some examples or to sort of demonstrate that. So obviously I've done a previous post where I talked a little bit about this, when I explained why I sort of ask sort of that medical questionnaire prior to a treatment. Now, when I first sort of started out on my journey into the field of massage back in 1997, showing my age now, that was when I completed my first diploma. The biggest thing, I think probably one of the biggest things coming out of that was to sort of really remember that list of contraindications, that we sort of given during the training. Now, I have to say it was a very basic list, and it included things like first 3 months of pregnancy, cancer, infectious conditions, skin diseases and inflammation, epilepsy, areas of scar tissue. We were told that these were things that you couldn't treat. High blood pressure was another one. And it also stated, you'd be told you must seek doctor's permission for any client with a medical condition. Now, unfortunately, the basic, and it was basic information that is given during massage diploma courses hasn't really changed in the last 23 years, despite the fact that client demographics and their reasons for having a massage treatment have changed dramatically. So, obviously we've got more and more clients seeking to combine complementary and the conventional healthcare treatments. And what used to be seen as this sort of luxury pampering treatment is now often a complementary medical treatment for chronic medical conditions. So, given that this client demographic and the reasons for having a massage have changed so much, surely that should be reflected in the massage training, so that we, then have therapists coming through who actually are aware of, certainly at least the more common medical issues that we see in practice, so that they know to ask the right questions and not put clients' health at risk. And unfortunately, this is something that I've seen from other therapists too often, and it can actually really do the client more harm. So it really is important. But so the reasons, behind this shift in sort of the reasons why people have massage treatments. Maybe sort of initially stemmed from the discovery of how massage could relieve pain in terminally ill patients. And of course, you know, when you do the diploma course, you're taught quite often, you know, things like cancer and terminally ill, you know, are contraindicated. But actually, you know, massage treatments are hugely beneficial, you know, in this area. So the massage profession is also now really starting to prove its effectiveness through conventional research methodology, you know, in much the same way as any medical treatment, which is sort of leading the scientific community to acknowledge that actually, you know, we are complementary to the medical profession. And certainly, you know, more doctors are sort of, you know, some are even prescribing massage treatments, you know, for a particular issue. So for this reason, it is essential that any massage therapist in today's society has a good understanding of common medical conditions, of the systems of the body that are affected with these conditions, underlying causes, signs, symptoms, side effects of medications, and indications and contraindications for massage in order to devise a safe treatment plan for their clients and not put their clients' health at risk. And, you know, I appreciate this. It's probably very easy for me to say, having been a nurse and a midwife, you know, but it is essential. You know, at the end of the day, you are dealing with clients' health and safety. And how can you instill confidence in your client? How can you treat them safely if you don't understand, you know, the physiology behind what you're doing or what you're treating? You can't. And it's also necessary, you know, that the therapist is confident in treating clients with medical issues, is aware of the risks, and knows when to refuse treatment. Not just, you know, again, I've seen therapists, you know, who just perform a completely inappropriate treatment on a client, which has resulted in clients being really very unwell for days afterwards. And unfortunately, this can be common practice in some places. So, you know, seeking out a qualified and registered professional is so important. Also, you know, the therapist should be confident in being able to refer to another professional within the multidisciplinary team to ensure the best outcome for the client. And it really is similar to when I was a nurse and a midwife. It's all about being accountable for your own practice, working safely, working at a level that you are competent in, and not going outside of those boundaries. Now, while massage training, it does teach some anatomy and contraindications, as I've said, it is very, very basic. And with many therapists not being registered with a regulatory body, you know, this means that there are too many out there who are making decisions which, as I've said, are not within their competencies, which does put the client's health at risk. And if that client wanted to make a complaint, you know, if the therapist isn't registered with a regulatory body, that client really doesn't have any sort of professional association to support them through that complaint. and help ensure the best outcome. So the client is kind of on their own, really, which, is not the way, it should be. Obviously, if you had to go into hospital for a surgery, for example, and there was some misconduct that resulted in you having long-term issues, you could go to the GMC, the General Medical Council, and you could seek sort of support with your complaint through them. Well, it should be the same with a massage, because it's still dealing with your healthcare. So, all therapists must be accountable for their practice, and that also includes things like keeping up to date with research and continuing to educate yourself about changes in medical treatments and things. I've worked with therapists, as I've said, and heard from clients, too many clients, that have said, that there are therapists out there doing some really inappropriate treatments, or who are, as I say, unable to explain what the issue is, sometimes even unable to identify the issue. And that's simply because they don't have the knowledge to do so. And because maybe, they've done just a basic massage diploma. And, to be fair to a lot of them, they probably go in and they think, well, I've got this diploma, so that's taught me, what I need to know. And they don't think anything of it, but actually they need to continue their education. So I'm going to now sort of give you a case study to kind of demonstrate what it is that I've been saying here. So, okay, so we have a client, Mrs. X. So Mrs. X comes in for a treatment to help with lower back pain. Now, during the medical consultation, that revealed that she was also hypertensive on doxazosine. She had mild COPD, IBS, and was also on warfarin, which is an anticoagulant therapy. Now, there's a few issues here that a massage therapist, if they're going to proceed with treatment, should be aware of and should understand in order to give a safe treatment and a comfortable treatment to Mrs. X. Firstly, she's a hypertensive on doxazosine. Now, doxazosine can cause vertigo and dizziness. So, it's important because, as we know, sometimes after a massage, some clients can feel a little bit dizzy. Now, this is even more important if someone is on a medication that can cause dizziness and vertigo. The therapist needs to be aware that they need to make sure the client sits up slowly after the massage to try and reduce the likelihood of them going dizzy. Now, also, by a basic massage diploma training, high blood pressure is a contraindication. But if you see my previous post on massage for hypertensives, the research shows that actually massage is very beneficial for hypertension. Due to we're taught it's a contraindication because of the improved circulation, so basically putting more pressure onto those artery walls. However, the research shows that massage is really beneficial because actually the effect on the nervous system means that massage brings about vasodilation, which obviously opens up those vessels, which reduces the blood pressure. So the problem is, how many therapists know that? The therapist also needs to check for if someone's saying they've had high blood pressure, they also need to check if they've had a past history of stroke or any heart disease. Because if these are present, then yes, the hypertension becomes a true contraindication to treatment due to the increased risk of one of these issues, being caused by the massage and therefore putting the client at risk. But a therapist who has done a basic massage diploma will not know this and will not know to ask these questions. And, the client may not think to bring it up. So it's really important that the therapist has this knowledge. Now, the second issue with Mrs. X, she has mild COPD, chronic obstructive pulmonary disease. Now, it's a chronic respiratory condition which may result in tight intercostal muscles, which are those ones in between the ribs, which can potentially cause difficulty in lying face down for too long. So alternative positioning may need to be considered. Now, working on the intercostal muscles can really help to improve breathing, but these muscles are generally not included in a standard massage treatment and are not taught in a basic diploma. So again, in terms of working on these muscles and providing alternative positioning, the therapist has to be aware, of these issues. The next thing, Mrs. X has IBS. So now a lot of therapists out there actually don't do stomach massage, even in a Swedish routine, which I think is appalling because the benefits of a good stomach massage, they really, there are so many benefits, both to physical and actually mental health as well. But deep abdominal work may need to be avoided due to the IBS, but alternatively, it may be beneficial to the IBS, depending on what symptoms are being experienced at the time of treatment. And so it's essential, therefore, that the therapist understands the anatomy of the condition and the symptoms, so that they know what type of massage to do or whether to avoid the stomach altogether, so that they don't make the IBS worse for the client. It may be that a Swedish massage may be more appropriate and could really benefit the client. Now, as I've said, many therapists, from their basic training, they don't have sufficient understanding of the condition and therefore don't know when to adapt the techniques. And finally, Mrs. X is on warfarin. Now, warfarin is an anticoagulant medication, so it thins the blood. Clients on this medication should be attending a warfarin clinic to be monitored so that their blood doesn't sort of become too thin or too thick. And the therapist must ascertain whether Mrs. X is controlled on her warfarin. If she's not, then treatment is contraindicated because, again, it could potentially cause a bleed, which could lead to a stroke. And certainly, you wouldn't really want to do a deep tissue massage or sports massage on someone on warfarin, because also those on warfarin are prone to excessive bruising. So deep pressure is a no-no. However, if Mrs. X is attending her warfarin clinics and she can show with her little yellow book that her warfarin levels, are controlled, then massage is possible, but would need to be a Swedish, and also liaison with her GP prior to treatment should be, carried out. Most massage therapists with basic training, again, would not have a clue what warfarin is, would not know to ask for this information, And so again, this is why it is important to see a therapist who is registered and who is highly qualified and experienced and who understands the anatomy and physiology. Now, another thing I want to briefly talk about is, I've mentioned it there about liaising with the client's doctor. Now, in clients with a complex medical history, or where it involves certain medications, it's professionally courteous and responsible to inform the client's doctor of the treatment, and it indicates that the therapist is aware of the potential impact on the client, and that in addition to being able to adapt techniques to work competently, that there is some recognition, that our own knowledge is limited. And, so to just have that sort of backup from another healthcare professional, even if we're medically qualified, even myself sort of having 2 medical degrees, it's still good to have that backup. And sure, a GP, for example, will not know as much about massage as we do. But likewise, we might not know as much about the medical stuff as the doctor does. So it's combining those resources, combining the knowledge, and just ensuring a safe outcome for your client. Also, in terms of registration and insurance, which any reputable therapist should have, this multidisciplinary liaison, it demonstrates clinical, ethical, and legal responsibility for the effects of a treatment on a client. And insurance companies, often require that a full medical history is taken, including treatments and medications. And in some cases, they will also require, medical consent from a GP, for example. So correspondence with the multidisciplinary team, may also serve, for asking specific advice if there's something that you as a therapist are not sure about. Maybe when muscular aches haven't improved after a few massage sessions, and, you might be unsure, maybe this medication is the reason why, because maybe muscle tension is a side effect. So liaising with, say, a GP, can just mean that maybe a client's medication needs to be changed to an alternative. Every individual is different and should be treated as such, but this will only happen if the therapist has the knowledge, experience, and clinical and ethical judgment required to fully understand their medical history. So I hope I have demonstrated why I talk so much about seeing, a qualified and registered and experienced therapist. And I hope I've helped you understand, why that's so important. I myself, I am a fully registered and insured practitioner. I have 2 medical degrees. I have a degree in nursing, I have a degree in midwifery, and I have a IHBC diploma in sort of Swedish massage, and also I have my sports therapy diploma as well. But if you're going for a massage, do ask them. Just ask them if they're registered and insured. Ask them what their qualifications are, because no good therapist is going to mind you asking, to put your mind at ease that you are seeing someone who knows their stuff and who is experienced. Anyway, as always, that's it for today. So feel free to subscribe to my channel. There's lots of posts on medical issues up there, and there'll be more coming. Feel free to comment down below, or contact me through my Facebook or Instagram, and I will come back to you. But yeah, for now, that's really it from me. So take care, and I'll see you next time. Bye.